Hi everybody, this is Dr. Michael Hirsch, the Chief Pandemic Information Officer for the City of Worcester and the Medical Director for the Division of Public Health. And as you might guess by our surroundings, I'm in a different place. I'm not in the basement studios of cable services for the city that are located at City Hall. I'm at the newly reopened Worcester Senior Center. And you can see how celebratory everything is. Everything is themed orange because the theme is Aren't You Glad That We're Back? And Worcester and the Senior Center are back. Today was the end of the state of emergency that was first declared on March 10th, 2020 by Governor Baker and followed up by City Manager Augustus on March 11th. And here we are. We've been through a lot together. There've unfortunately been quite a few losses. Almost 430 Worcester residents have perished through the pandemic time. Many people infected. But we have finally come through this with our heads held high because of all the hard work that you all have been doing. And particularly I want to emphasize the seniors have done so much heavy lifting for us because we took away this wonderful place for them to congregate and get their exercise and get their education and have their recreation. And they had to weather the storm kind of locked in. They had to be extra careful because we discovered soon after the pandemic broke that seniors were our most vulnerable population, and they complied with everything. 3 Ws, no problem. Isolation, no problem. Getting their groceries delivered, making sure that they were staying as safe as they possibly could. But more importantly, they became advocates and very important advisors to the rest of their family about taking this seriously. Taking it seriously, yes, but also saying, look, I went through some very, very bad times when I was a youth, whether it was World War II, the Depression, the Korean War, the atomic age and the worry about the Cold War, the Cuban nuclear crisis in '62. There have been a lot of things that people in the senior center age group have experienced. And they were able to calm their relatives down and say, there's been worse times. There have been times when we could have all been blown up with a nuclear weapon. This pandemic is going to pass, and now it has. It's passed because for the first 9 months of it, we really stuck to the 3 Ws. And with the help of the city manager and the mayor, we were able to get the word out to you very well received in this population. And then, once we got the vaccinations, we now have a vaccination rate in this senior age group of close to 90%. And that's kept this virus at bay. Even the variants haven't been able to really take root. And the number of cases have gone down and the number of deaths have gone down. And we've been able to stand down vaccination centers. We stood down the DCU center, which was our emergency spillover hospital for COVID people. And we're starting to lose all of the mandates, no more mask mandates for vaccinated people. Now, unvaccinated people, it's a different story. And here's where you can be a big help to me. If you have some people in your family that are still not vaccinated, it's not great for them to still be hanging around with the vaccinated folk. They can still be spreading stuff and catching stuff. So they're the ones that are supposed to be still masked. And the unvaccinated are our biggest risk right now. And our rate of vaccination here in Worcester, we're at about 50% of the community has been totally vaccinated, and about 60% has had 1 dose. We'd love to see those numbers get up into the 70s. And that was the hope that President Biden and Governor Baker expressed, that we would get there by July 4th. As we're taping this, I'm not sure we're going to make it in that close amount of time, but there's really no more excuse about not getting your vaccine. All of the grocery stores that have pharmacies have vaccination programs. All of the pharmacies themselves, CVS, Walgreens, all have vaccination programs. There's still a stand-up at the Mercantile Center. Walk in and UMass will give you, no questions asked, a vaccine. And there are many other venues you'll see popping up. Banks can give them. And we have rolling mobile clinics that are still going out trying to get to the people that can't get to us. If you're one of those people, that we call homebound, that it's just not easy for you to get out and around and you've been waiting for the vaccine, but you can't get out to get it, there's a telephone number that you're going to see on the screen that you can call and get an appointment to have a mobile unit come to your house. So we can't make it any easier than we have. The vaccinations are very, very safe. We've seen that now, and very effective because the numbers are going way, way, way down. So we're so excited that we've come to this point in our pandemic history, and we're hoping that the summer is going to see this thing really melt away. There is a little bit of a risk now with the variant that's come from India. India, as you may have heard, has had a big outbreak, but most of their outbreak has come because they haven't had any vaccination going on. So no matter what kind of variant was there, they were going to have a lot of spread. Supposedly now in the United States, 7% of the new cases of the virus are this new variant. It's called the Delta variant. And it doubles in prevalence and frequency every 2 weeks. But even as it's been doing that, it has not caused an outbreak yet here in the States. There are probably hot pockets around the country where the vaccination rates are too low, and they may see outbreaks there. But here in the Commonwealth, we're very, very lucky. And we are the second most densely vaccinated population of all the 50 states. So I think that we've done a really great job. I think that the Senior Center here is trying to tell us we've got to try to come out to this new normal. Is the vaccine going to eliminate any risk? I don't think it will be 100% eliminated. I don't think COVID is really going to go completely away. I think it's going to be some background noise for several years. But we can live with it because we know now how to test for it quickly. We know how to isolate and quarantine in case we see a flare-up. And we also have the vaccines that seem to be very, very successful against fighting these. There's going to be more news coming from me. I'm still going to be doing these sessions with you because I think there might be information about boosters. There might be information about the FDA approving the vaccine for little children between the ages of 2 and 11, and that would be a big, big help. That's like the last big block of unvaccinated people. But in the meantime, anything you can do to convince family members that haven't been vaccinated to get their vaccination, please, please work with us to do that. You've always been our biggest supporters, and the city manager and the mayor and I are so appreciative of that. And it's just a privilege to come back to this wonderful place that we used as a vaccination center and see it back set up as a beautiful dining hall for the beautiful elders that were here for a program that we did earlier. I told at that program a little story about Worcester having its 299th birthday on June 14th, which happens to be Flag Day. And next year, at this time, June 14th, 2022, we ought to have a big party for everyone, but particularly you seniors who have gone through so much in your life and added this pandemic to that. You deserve all the celebrations that we could do. So thank you very much. It's great to be with you again. Hang in there, and I'll see you next month.